Choosing a health insurance policy can be a bit of a challenge. So to help you get the most out of your insurance, PrivateHealthgovau is here to help you find the policy that best suits you. PrivateHealthgovau is Australia's only truly independent website, gathering the best information available on all private health insurance funds in the country. Comparing policies is easy. Simply select Compare Policies from the menu. This will allow you to compare every health insurance policy from any health insurance fund in Australia. First, you will be asked some simple questions. Things like, which state do you live in? Who will the policy need to cover? And do you require hospital cover, general treatment, or both? If you find that you have too many results to compare, you can narrow down your selection by answering a couple of additional questions, like what level of cover do you need? Or would you be happy to pay in excess? Once you have answered these questions, a list of results is displayed on screen. You can sort any list of policies by clicking the heading at the top of each column. For example, clicking Premium once will sort policies from least to most expensive. Clicking Premium again will sort policies from the most to least expensive. To choose the policies you want to compare, simply click on the checkboxes next to the policies you are interested in, then click the Compare Selected Policies button near the bottom of the page. Your selected policies will appear on screen for you to compare. If you included hospital policies in your selection, you will find a green tick indicates hospital benefits that are covered and a red cross indicates hospital exclusions and restrictions. If you included general treatment policies, the level of benefits covered is represented by a green B. To review the level of limits for each policy, click on the Limits button. The level of limits is represented by a green L. 1 is below average, 2 is average, and 3 is above average. You can toggle between benefits and limits simply by clicking on the appropriate button. And if you hover over an icon, an explanation will appear. Finally, you can generate a more detailed report that can be downloaded or printed by clicking the Generate Standard Information or SIS report button towards the bottom of the page. The SIS report includes a comparative price to help you compare policies. To get a quote or find out more about a policy that you are interested in, simply contact the Health Fund directly. Contact details can be found on your SIS report or this website. So there you have it. With a little work, you are now well on your way to finding the right health insurance policy for you. If you require additional help with this website or more information about private health insurance, just call us or complete the Ask a Question form, which can be found on this website.
Understanding your healthcare coverage may feel more difficult than acing your interview. Here's help.
As if healthcare weren't already confusing enough, it also comes with its own totally baffling lingo. When discussing insurance, perhaps the most commonly confused term is a plan's deductible. A deductible refers to the amount that you need to pay on your own before your insurance will kick in and cover the healthcare costs. So, if you had a $1,000 deductible and spent $5,500 total in healthcare this year, your insurance would only provide coverage against $4,500 of your total costs. Deductibles are not usually applied to basic healthcare, such as visits to your primary care physician and gynecologist. Approved doctors are usually referred to as in-network and are chosen by your health insurance provider. Similarly, out-of-network doctors are those that your health insurance will not pay for entirely, or at all. Another confusing term, pre-existing conditions, refers to any health condition that you have already been diagnosed with prior to selecting your insurance. Whether or not additional costs related to a pre-existing condition will be covered by your new insurance depends on a number of factors, including what condition it is, whether you are currently covered by health insurance of some kind, and the type and quality of your new insurance. If you do have a pre-existing condition, you should make sure that you understand how your new insurance will treat ongoing costs related to it. Another term to be familiar with is an exclusion, which is when your insurance company will not cover a healthcare service. While these are just a few of the commonly misunderstood terms you'll find in your insurance plan, understanding these concepts will make it a lot easier to understand what's covered and what's not.